During Nightingale's time in the Crimean War, patients presenting with various mental disorders resulting from combat stress were originally diagnosed as cases of shell shock, which we now know to be PTSD. Since the terms and understanding of mental health in the 1950s was very limited, we can describe what her diagnosis would be in modern terms. A complete nursing diagnosis today is composed of a diagnostic label, related factors, definition, risk factors, and support of the diagnostic statement. If a person who survived war shows signs of aggression, anxiety, difficulty concentrating, and etc., then the nursing diagnosis will be a post-trauma syndrome. Nightingale's diagnostic label would be readiness for enhanced mental well-being. The related factors would be sudden destruction of one's community, being held prisoner of war, serious injury to self, serious threat to self, and torture. The definition of post-trauma syndrome is sustained maladaptive response to a traumatic, overwhelming event. The risk factors are perception of event, occupation, survivor's role, and unsupportive environment. She would support her diagnostic label by asking the patient questions such as, did you have motivation to do your hobbies today? How well are you feeling on the scale of 1 to 10? Did you have any anxiety attacks? And does remember the event make you feel uneasy? Will create an evaluation of how the patient stands on the diagnosis. Of course, it is also important to state observations that will depend on the nurse creating the diagnosis. Furthermore, this is where a wellness nursing diagnosis would help. If the patient is diagnosed with the post-trauma syndrome, his or her nursing care should be focused not only on physical healing but also mental, spiritual, and emotional too. In Florence Nightingale's theory, it says that the environment has an impact on the patient, so making the feel of the patient's room light and comfortable can improve his mood. Also, giving the patient a fresh environment will make him see that he is not in a devastating place anymore. In this diagnosis, the patient will be helped to achieve wellness, and that means being healed in all other aspects.